Welcome back to NURS 238, Classification and Management of Mental Disorders. We now want to look at the dissociative disorders. The Diagnostic and Statistical Manual 4 describes the essential features of dissociative disorders as a disruption in the usually integrated functions of consciousness, memory, identity, or perception of the environment. Dissociative responses occur when anxiety becomes overwhelming and the personality becomes disorganized. Defense mechanisms that normally govern consciousness, identity, and memory break down, and behavior occurs with little or no participation on the part of the conscious personality. 4 types of dissociative disorders are described by DSM-4. They include dissociative amnesia, dissociative fugue, dissociative identity disorder, and depersonalization disorder. Of course, in passing, we will also mention derealization. Let's start with dissociative amnesia. Dissociative amnesia is an inability to recall, or the client cannot remember important personal information, usually of a traumatic or stressful nature. Amnesia is the most common dissociative symptom and is not due to the direct effect of substance use or a general medical condition. It is more frequently seen in females, adolescents, and young adults. 5 types of disturbance in recall have been described. In the following examples, the individual is involved in a traumatic automobile accident in which a loved one is killed. So the first one I want to describe among the dissociative amnesias is localized amnesia. In localized amnesia, the inability to recall an incident, all incidents. So the inability to recall all incidents associated with the traumatic event for a specific time period following the event, usually a few hours to a few days. An example: the individual in the automobile accident. The individual cannot recall events of the automobile accident and events occurring during a period after the accident, a few hours to a few days. The next dissociative amnesia is selective amnesia. The inability to recall only certain incidents associated with a traumatic event for a specific period after the event. Example: the individual may not remember events leading to the impact of the accident, but may remember being taken away in the ambulance. The next dissociative amnesia is generalized amnesia. The rare phenomenon of not being able to recall anything that has happened during the individual's entire lifetime, including his or her personal identity. Then we have continuous amnesia, the inability to recall events occurring after a specific time up to and including the present. Example: the individual cannot remember events associated with the automobile accident and anything that has occurred since. That is, the individual cannot form new memories, even though apparently alert and aware. Systematized amnesia. This is the last one. Then we look at the nursing responsibilities. With this type of amnesia, that is systematized amnesia, the individual cannot remember events that relate to a specific category of information, such as one's family or to one particular person or event. Clients suffering from amnesia are often brought to the general hospital emergency department by police or who have found them wandering confusedly around the streets. The symptoms of dissociation usually begin and end abruptly. Patients may experience recurrences, but recovery is usually complete. Let's look at what the nurse does, or the nurse responsibilities, or the nursing care towards an individual suffering from dissociative amnesia. Obtain as much information as possible about the client from family and significant others if possible. Consider likes, dislikes important people, activities, music, pets, etc. Do not flood client with data regarding his or her post life. Instead, expose client to stimuli that represent pleasant experiences from the past, such as smells associated with enjoyable activities, beloved pets, and music known to have been pleasurable to the client. As memory begins to return, engage client in activities that may provide additional stimulation. Let's continue with the nursing care. Encourage client to discuss situations that have been especially stressful and to exploit the feelings associated with those times. Identify specific conflicts that remain unresolved and assist client to identify possible solutions. Unless these underlying conflicts are resolved, any improvement in coping behaviors must be viewed as only temporary. Provide instruction regarding more adaptive ways to respond to anxiety so that dissociative behaviors are no longer needed. Benzodiazepines are useful in recovering lost memories. Hypnosis and relaxation techniques may facilitate recall. The next dissociative disorder I want to look at is dissociative fugue. Dissociative fugue, the characteristic, it is rare anyway, but the characteristic feature of dissociative fugue is a sudden, unexpected travel away from home or customary place of daily activities with inability to recall some or all of one's past. An individual in a fugue state cannot recall personal identity and often assume a new identity. How do we nurse? Let's continue. Nehemiah 1989 states, during the fugue, they completely forget their past lives and associations, but unlike the clients with amnesia, they are unaware that they have forgotten anything. It is only when they suddenly come back to their former selves that they recall the time preceding the onset of the fugue, but how they are amnestic for the period covered by the fugue itself. Duration is usually brief, hours to days, or more rarely, months. Recurrence of fugue are not common. Common stresses include marital, financial, and occupational difficulties. Some authorities say information from other sources usually reveals excessive alcohol use precipitated the fugue behavior. Barbiturates, benzodiazepines, psychotherapy, hypnosis, and relaxation techniques may be useful to facilitate recall. How do we nurse an individual suffering from dissociative fugue? Maintain low level of stimuli in client's environment. Low lighting, few people, simple decor, low noise level, etc. Anxiety levels rises in stimulating environment. Observe client's behavior frequently to ensure his or her or others' safety. Remove all dangerous objects from client's environment so in his agitated state he will not use them to harm self or others. Try to redirect violent behaviors or channel violent behaviors with physical outlets for the client's anxiety. Example, punching a bag. Let's continue with the nursing care. Staff should maintain and convey a calm attitude to client anxiety. Let me take that again. Staff should maintain and convey a calm attitude to client anxiety, or for client anxiety is contagious and can be transmitted from staff to client. Have sufficient staff available to indicate a show of strength to client if it becomes necessary. Administer medications as prescribed by the physician. Identify stressor that precipitates severe anxiety. Have clients identify methods of coping with stress in the past and determine whether the response was adaptive or maladaptive. This information is necessary for client to develop a plan of action for the future. So this has to do with dissociative fugue. And I expect you to read from these references that are put up here for more information on dissociative fugue.